Cataracts are one of the most common eye health conditions associated with aging, and the fact is there's a disconnect between people's perception of what life is like before and after cataract surgery. Well, here to educate us on this condition is ophthalmologist Dr. Lawrence Woodard. Good morning, doctor.
Good morning, Alex. How are you?
I'm great. It's a pleasure to have you on. So for people, who may not exactly know what it is, I'm sure they've heard of it, but what are cataracts?
Well, cataracts are actually a very common condition affecting many people here in the United States. 24 million people over the age of 40 have cataracts, so you see it's a very common problem. A cataract simply represents a clouding of the lens inside the eye that is a natural process due to ultraviolet light exposure from the sun over our lifetime. So removing cataracts actually eliminates this cloudy lens and replaces it with a lens implant to improve our quality of vision.
It's impressive stuff, and there was actually a survey recently that found some pretty shocking things. Can you tell us what it discovered?
Yes, that survey was by Alcon, and it was of 1,300 people who were over the age of 60 who had undergone cataract surgery. And what it found was that 3 out of 4 individuals reported that they had a significant greater appreciation for life after cataract surgery and were much happier. And of the people that underwent surgery, 93% of them recommended surgery to a friend or family member. So it really displays how significant cataract surgery can impact the life of a patient.
Well, certainly, and it's interesting to see how it affects different races and ethnicities. So what have you found around there and how it affects different groups?
Well, yes, what we have found is that everyone will develop cataracts if you live long enough. However, African Americans are twice as likely to develop cataracts early in life, and in the Hispanic community we find that cataracts are the #1 cause of vision impairment. And the reason for this, we feel, is significantly related to the prevalence of diabetes in these two communities.
Okay, interesting findings. And so you found that, there's certain ways to fix it. What are some ways to remedy it? I know you mentioned the lens that we put in the eye, but what are some other ways that maybe we can prevent it or how we can fix it and treat it?
And so we can't actually prevent cataracts because it's an aging process. However, we can impact the rate at which they develop. And we do that by protecting our eyes from ultraviolet light exposure over our lifetime. Anytime we're outside, protect our eyes from the sun to decrease the rate at which the cataracts develop.
Okay, and aside from cataracts, what are some other eye conditions that people should really be looking out for and go to their ophthalmologist and their eye doctor to check?
So cataracts are one of many conditions that can affect the quality of someone's vision. Macular degeneration, glaucoma are two of the more common things. And that's really why we have this My Cataract Awareness campaign to show people that this condition is really the most prevalent of all conditions that affect the quality of life, and we actually have a great treatment for it. And that same survey did reveal that 93% of the patients that underwent surgery recommended it. So it really shows how successful the surgery is.
Well, certainly it improves their quality of life. And if people want to learn a little bit more for themselves, get more resources, and learn about the campaign, where can they go?
Yes, the website is a great resource. That's mycataracts.com or the phone number 1-844-MY-CATARACT. We'll give a lot more information about cataracts as well as the various treatment options that are available.
Very good. We will make sure to check it out. Doctor, thanks so much for joining us today.
Thank you for having me.
All right. Now, guys, stay right where you are. The Morning Blend will be right back.